A patient called Sophia, 21 years old, and was admitted to the hospital complaining about strong pain in the back, as well as insomnia, imbalance, and lack of movement. The patient was being monitored since she was 7 years old. Then she used a plastic brace since then, but then she forgot some days, she didn't use it properly. So the plastic brace and other treatments to correct her beginning of her scoliosis didn't work. And with age, there was worsening of the cases in the condition of the patient, increasing the pain. So the pain didn't go away with other medication. With physical therapy, the patient is receiving nerve block injections for relief. The degree of the disease 5 years ago was 35, according to the past exams, 35 degrees, the angulation of the spine. According to the past exams of the patient broke all, and at this time she was diagnosed with middle scoliosis. We also perceived that palpitations were felt during pain attacks. So about the past history of the patient presented growth hormone increase and was declaring for gigantism since she was a kid. About the subjective examination, there is no alcohol intake, no smoking. She was active before, but with the origin of the condition, she's not active now. There is bad diet present, no chronic diseases, no allergy. She was admitted. She got surgery 5 years ago because she broke her arm, and vaccination was done. The conclusion here is middle to severe scoliosis. So we passed to general inspection. The general condition of the patient was satisfactory. She looked as according to her age. The patient was conscious, 15 according to the Glasgow scale. The posture was forced. The face of the patient was suffering face. The constitution is normosthenic. There is no subcutaneous fat was normal, no edema, lymphatic was normal, muscular bones joints were normal. Eyes, lips, neck, and thyroid glands, as well as the body temperature, were also normal. By investigation the vertebral column, we could see that it presented an S-shaped curve with angulation of 45 degrees. So, during objective examination of the respiratory system, we perceived that the patient presented dyspnea, as well as a symmetric chest. The cardiovascular system, we could see that there was a slight increase or heart rate due to pain attacks. GIT and urinary system were normal. And then local status of spine, we can perceive that the patient had asymmetrical shoulders. The left arm is longer than the right arm, as well it was asymmetrical, the spine was asymmetrical, and the forehead. The conclusion here is that the patient presented a progression from mild scoliosis to severe scoliosis. The doctor here asked for a laboratory examination, lab exams were done. We asked for a complete blood test, COVID, HIV, hepatitis, and nothing changed, anything was abnormal here. We can also ask for a urine test. In this case, anything is normal, everything is normal. About the instrumental examination, we asked for an X-ray and also a CT scan, computed tomography. The conclusion was a severe scoliosis of 69 degrees in the thoracic region and 46 degrees actually in the lumbar region. So those configurate a severe scoliosis that should be treated with surgery. So about the epicrisis evaluation of the patient, there was no coexisting diseases. Then it's indicated absolutely there is no contraindications. The patient will be under general anesthesia. The risk is super high because it's the spine, so it's 75% chance of success. The complications were bleeding, spinal column damage, and paralysis, as well as thrombosis and death. The treatment here, we decided for surgery. So before the surgery, the patient will be admitted. He may be admitted 1 day before, and she'll be on the NPO diet. We need to do a shaving of her lumbar part, of her back part, the extremities as well, and also the gluteal region. So, and the patient will receive nail trimming and will be admitted, as well as monitoring and pre-medication. So about the surgery, intraoperative treatment will be called vertebral body tethering. That is less invasive procedure than a spinal fusion that usually was preferred ages ago. So it is performed anteriorly through the side using small incisions called portals, with a scope and camera for visualizing the access to the spine. And these small incisions will result in a minimal scarring. And the medications used here in the post-operatory is going to be anticoagulants, analgesics, anti-inflammatories. The patient will be placed laying down at the belly, and she will stay in the hospital for 7 days in the general ward in the orthopedics department. She'll be monitoring. We do X-ray before the discharge of the patient, 1 day before, and the successive days until discharging of the patient. The pain here needs to be diminished. It cannot be a strong pain, and we need as well as physiotherapy, breathing physiotherapy to the patient, and if the patient couldn't walk, we administrate compressive stockings.